time to achieve a great smile.
Yay!
That's why we call on the efforts of our very favorite dentist. How about Dr. Stephanie in studio from Plaza Dental? And this morning we're talking about something that is pretty serious, and it got some attention a while ago because of something that happened to an actor we all know. Michael Douglas talked about getting oral and gum cancer, and then there was somebody else who, as recently as an article came out this morning, the drummer for the rock band Poison, Ricky Rocket, announced that he has oral cancer. He has been treated for it. He said one of the worst cancers to treat, but it is treatable.
Yes.
But he is going through this now, and he wants to get out and tell everybody what in the world causes this. He's 54 years old, and they say guys over 50 are more susceptible to getting this.
Right, absolutely, yeah. And smokers are much more susceptible. I mean, I'm not sure that there's a cancer alive that isn't affected by smoking. And it's the combination of smoking and alcohol. And even alcohol in mouth rinses.
No way.
Yes. Yeah.
Really? Seriously?
Yeah. It's. I mean, it's the same compound. It's alcohol. So I mean,
are you talking about wine and beer?
I'm talking about wine and beer, but I'm also talking about
like Listerine.
Scope and Listerine.
Listerine causes cancer.
Do you rinse your mouth with wine and beer? Or, I mean, is that
on Friday and Saturday nights?
No, that's okay. But yeah, so that's one of the things is that the combination of smoking and alcohol is actually a really bad combination.
Wow.
Right. So, but yeah, even mouth rinses. So they have new mouth rinses that they've taken a lot of the alcohol out of,
right.
because of that reason, because it's not really necessary. It dries out the mouth. It can actually cause bad breath, which is kind of funny. If you dry out the mouth, you have more tendency to get bad breath. But that alcohol in different products will cause some of that drying.
Now let's talk about something else that some people they're saying that it possibly could be related to. We're talking about the old fillings that a lot of us used to get.
Right, can be attributed to mercury fillings because
there's the old mercury filling there on the left.
And really, it's still used. I mean, we still use it in the United States. We don't use it in our office and haven't for years and years and years because we just don't believe that if there are two places that I can put a silver or mercury silver filling. I can put one in your mouth, anybody's mouth, and I can put it in the hazardous waste, but I can't put it in the trash. I can't put it down the sink.
Are you serious?
I'm totally serious. Yeah, I have to put it in hazardous waste or in you.
You can put
That's it. Yeah.
But having a filling, if you had one way back in the day, that could cause issues.
Well, I mean, it's definitely, there's controversy as far as mercury is definitely a toxic material. Right. So I mean, the fact that we still in this country allow people to put it in is kind of crazy, really. And I mean, and that's my opinion. There's a lot of different opinions about that.
What the reasoning behind using that type of filling was?
Yes, it's very durable. It's very. It can be. It's called amalgam. It can be amalgamated or made into a kind of a paste or that you can put into a tooth very easily into a filling, and it's durable. I mean, they do last a very long time. I mean, people have mercury silver amalgam fillings that they've had in for 20, 30, 40 years.
I think I have some right now.
Right, absolutely.
Really?
So I mean, we don't necessarily advocate taking out a good filling, but at the same time, if somebody has an issue, it's not a bad thing to have it taken out.
All right.
Yeah.
Is it a major process
I was
to
gonna say,
remove
what's a process like that?
Yeah, it's just taking out. I mean, most people have had a filling, so it's not any different than taking it out. However, when you do have mercury fillings taken out, we use a different process. We use we actually give oxygen to the patient. We use a protective dental dam that we put over the tooth, and so that none of that
like the rubber
residue,
trampoline type
the
thing?
rubber trampoline, none of that residue gets into the the mouth or the throat.
Yeah, and there's a dentist behind a shield. They got some remote control, robotic thing to do.
Not yet.
To be clear,
no, I'm sure
the major
happen.
cause of oral cancer is smoking.
Yeah, smoking. And the other cause that's really common is HPV, human papillomavirus. So it's a sexually transmitted disease as well that can live in the oral cavity. So it's something that's actually like a major cause of oral cancer.
How often does this happen? Because I feel like you don't hear about mouth cancer.
So oral cancer is more common than cervical cancer.
Really?
Yes. It's more common. You're right. We don't talk about it as much.
We don't hear much about it at all.
Luckily, most oral cancers are caught by a dentist doing, they pull out your tongue and they look underneath it and feel your neck and all that kind of thing. It's caught by those types of exams more than anything else. And if somebody has something in their mouth that just isn't healing, a sore in their mouth that doesn't heal, that's a bad sign. So it's, we really, I mean, most people visit their dentist on a reasonably regular basis, hopefully, it's good for you, because we can check for those types of cancers, and it is. It's more common than cervical cancer, and it just doesn't get a lot of press.
Okay,
so
we've talked about smoking. We talked about alcohol, and alcohol-based mouthwash is not good and could possibly cause this mercury fillings. And what about chewing tobacco?
Oh yeah, that's terrible. I mean,
it might be terrible, but is that something else? Because there's people out there watching going, what about chew?
Tobacco. If anytime we talk about smoking, tobacco is tobacco, and so chew. And actually, chewing tobacco, because people put it in one specific spot usually. I mean, you know, if you're going to chew tobacco, move it to different spots. That's not a great strategy, really. I mean, you know, having that in your mouth is a very, very high risk of oral cancer, right? Yeah.
Wow.
So I know there's so many things that I mean, we don't realize what it does, and then
you've really brought the whole show down.
No,
I know. I'm sorry.
No, but seriously, you need to think about this.
It's good to know this information, but it's another good reason to go to your dentist. But find someone who cares. Like, I've been to a dentist before; they've never.
Right. Yeah. So here's the other thing that's really interesting too is that sure. I mean, we all should. Everybody should get one of those every year, you know, at least. And most people, it's just a matter, of course, they do them every time that they have somebody in the chair. But it's very, very important that you just have that kind of regular checkup, because there's so many things that we're looking for that we don't tell you that we're looking for all the time. It's really important that you actually think about that, and I mean, I know a lot of people don't like to go to the dentist. I get it. I really do. I hear it every day, so I know. But it's really important that we really have those checks.
It's about education, and it's a continued conversation about prevention.
Right.
And we'll talk
and if
more
you're
about
uncomfortable, like you said, if you're uncomfortable going to, you know, where you're going, or somebody lectures you or makes you feel bad or something like that, you know, we have total amnesty. We're nice to people. You know, we don't want them to feel like they're little kids.
And if they want to get in touch with you guys, what's the best way to do so?
The best way is dmsmiles.com. That's our website, and it's the easiest way to find us, and we're on Jordan Creek Parkway. So
wonderful, wonderful, good job.
Thank you so much. Great information.
Have a good holiday.
You too.
All right.